Hello, ladies and gentlemen. Welcome to Cardiology Lectures. I am Dr. Nik Nikam. I used to work at the Texas Medical Center as an interventional cardiologist, and I also used to work at smaller hospitals in the Houston area. Today, we are going to look at PCI volumes and outcomes. This was reported in the American Journal of Cardiology by Alexander Faneroff. The data was derived from the National Cardiovascular Registry. They looked at PCI patients between July 1, 2009 and March 31, 2015. Based on the number of procedures performed by the interventionalist, they were divided into three major groups. The low volume group consisted of interventionalists who performed less than 50 PCIs per year. As you remember, the American College of Cardiology recommends a minimum of 50 interventional cases per year to maintain adequate training. The intermediate volume group performed between 50 and 100 PCIs per year, and of course the high volume group performed more than 100 PCIs per year. What is most interesting is for the entire group, the mean PCI procedures was 59. Let's keep that in mind. Let's look at the main outcome that was observed in this study. That was the mortality. But before we get into the mortality, among the three groups we talked about, 44% of them belonged to the low volume group. That means they performed less than 50 PCIs per year, whereas the intermediate and the high volume groups were pretty similar. It also tells that only a third of the interventionalists were performing greater than 100 PCIs per year. That is approximately 2 PCIs per week, assuming you don't take any vacation. And as I told you, this was reported by Alexander Faneroff in the Journal of American College of Cardiology, 2017. The data was derived from the National Cardiovascular Data Registry. Now let's look at the mortality among these groups. The low volume group had a mortality of 1.86%. The intermediate group had a mortality of 1.73%. and the high volume group had a mortality of 1.53%. So clearly there is a difference between the low volume group and the high volume group interventionalist. However, some of the important characteristics we need to keep in mind with reference to the low volume operators, which include they operated in lower volume hospitals. They were more frequently performing emergent PCI and PCI for STEMI, less frequently used radial access, and greatest volume of contrast and fluoroscopy times. I have worked in both low volume hospitals and at the Texas Medical Center hospitals. So from my personal experience, I can tell you something about lower volume hospitals. The lower volume hospitals may not have the most extensive technology available, which is readily available at the medical center hospitals. Also, the low volume hospitals may not have the most experienced staff support that you see in the major medical center hospitals. As a matter of fact, some of the lower volume hospitals perform PCIs with no surgical backup. And when patients really get into trouble, they lose time in transferring these patients to the institutions that have surgical backup. Experienced senior staff members may not be readily available when you are performing a procedure and need some assistance. But in a major medical center hospital, there are several physicians working simultaneously who can assist you in case of an emergency. And also, lower volume hospitals, the post-procedure support may not be as advanced as it is at the major medical center hospitals. That reminds me of a case which I reviewed where the patient's restlessness and tachycardia was attributed to drug effect rather than a developing intra-abdominal hematoma. This is just an anecdotal case, but it underscores the limitations that you face in lower volume hospitals. But I'm more interested in how we can improve our technical skills, how we can improve our knowledge, and how we can improve our confidence. These are my personal recommendations. These are not the recommendations of any institution or any medical center. Since I worked at the medical center and also at lower volume hospitals, I always had privileges at the medical center hospitals. So I would recommend you to have privileges at the major medical center hospital. If you refer any patients to these major medical center hospitals, make sure that you have privileges to scrub with the experienced staff members so you learn from their experience. I would also recommend attending interventional seminars at these major medical center hospitals, even if it takes time away from your practice. When you refer complex cases, have an arrangement that you can assist on your patients so you gain additional experience. I personally used to watch CCI interventional cases which were broadcasted live on internet by Mount Sinai team, Samin Sharma and his associates. Here you can watch the entire case. You can learn about their case selections, techniques, and how they manage complications in the cath lab. It's a great learning experience. This is the same technique used by Olympic athletes who mentally visualize their exercises so that they become quite familiar with the technique. So by watching these cases on a weekly basis, you almost double your experience of going through the motions of performing interventions. It also teaches you the latest gadgets that are available in the market for handling patients so that you are knowledgeable about what to order for your institution. If you do not have an interventional cardiology weekly meeting at your institution, I would strongly recommend establishing an interinstitutional interventional seminar every 2 weeks or once a month in your city so that all the interventional cardiologists can bring their cases, discuss, and get suggestions from experienced cardiologists. You can also invite medical center experts to come and talk about a particular topic with reference to interventional cardiology. So by getting involved, getting engaged in these various types of activities, you develop one, the basic medical knowledge, number two, the technical expertise, and also see how experienced cardiologists approach a particular problem when dealing with interventional cardiology patients. Here is the link to the Mount Sinai CCI live cases, and here you can copy this to your URL and bookmark it so that you can watch not only their live cases, but also you can search through their extensive library and look at a particular case such as chronic total occlusion, right coronary artery occlusion, left main coronary occlusion, so that if you have a particular case, you are already mentally prepared. You have already walked through similar cases or more challenging cases so that when you enter the cath lab, you can enter with confidence and do the best for your patients. I am Dr. Nik Nikam. Thank you so much for watching this presentation. And please do subscribe to our YouTube channel where we have more than 130 cardiology related lectures. Thank you so much for your attention.